April Trupiano, your host of StreetScape, and on this episode, Renaissance Plastic Surgery joins us again to give you everything you ever wanted to know but were too afraid to ask about breast augmentation.
Well, last month we visited Renaissance Plastic Surgery in our medical spa and talked with Dr. Boschert about the Zerona, which is a laser fat reduction system. Well, we're back with Dr. Paul Mills, who is going to talk to us about breast augmentation. So, Dr. Mills, who would be the typical candidate for that?
The typical candidate for breast augmentation falls into a couple different categories. It can be the young patient between usually 18 to 25 who has small breasts to begin with, or potentially has some sort of birth defect or congenital defect in which they have one breast that is smaller than the other, and therefore we're trying to even them out. The other group of patients tend to be those that have gone through their childbearing years, or they have potentially lost some volume with breastfeeding. And in that particular situation, we're trying to not only increase the size of their breast by increasing that volume again, but also potentially talk about a breast lift.
Well, what are the options?
When we talk about breast augmentation, you have several different options. Number one is the type of implant. We have saline implants or saltwater implants, and in that particular case, it's simply a silicone polymer shell filled with salt water. The second option is that of a silicone gel implant. That, as indicated by the name, is again a silicone polymer shell, but instead it's filled with a silicone gel. And each of these implants is very different. The saltwater implants tend to behave a little less like natural breast tissue. They don't have the same feel as breast tissue does. At the same time, they behave very differently if for some reason you should get a leak in an implant. When we talk about the leakage rate, for silicone implants, that is about 0.3% chance per implant per year. And so therefore, when you talk about a 10-year rate, that's about 6%. With the saline implants, it tends to be almost twice that amount. If it's a saltwater or saline implant, well, once you get a leak in that implant, then it's saltwater. It gets absorbed into your system. However, with a silicone implant, it's a little bit different because it tends to be more of a warm gummy bear type feel. And therefore, the silicone doesn't really go anywhere. It's simply that you may have very tiny quantities leak out, and those are the quantities that get picked up on MRI to detect if there's a leak. The other differences are simply in the appearance of the breast. Saline implants tend to cause a little bit more rippling or waviness, whereas a silicone gel implant is going to behave much more like a natural breast. Other options that we may consider is where to put the incision. Your incision can either be under the arm, it can be around the areola, or it can even be underneath the breast. And each of those has advantages and disadvantages. The third option is that of where to put the implant. Do you put the implant on top of or below the chest muscle? The majority of my patients tend to have the implant put in below the chest muscle. That tends to give more of a natural appearance and tends to make it less well defined while still increasing the breast size overall.
Well, here at Renaissance Plastic Surgery, you're very patient-focused. So what can a client expect when they come to meet with you?
From the time you walk in, it's about you. It's about the time that you spend with us. It's the reason that I spend an hour or more of my time speaking with you, discussing the options, going over the various different ways in which we do surgery. But it's also the way my nurses treat my patients. It's also the different steps that we take to make sure that you're happy with the end result.
What kind of advice would you give for a woman who is looking for a doctor for this kind of procedure?
Good question. First of all, you need to make sure that the surgeon that you're considering for your surgery is board certified. Specifically in plastic surgery, there are boards that are based more in cosmetic surgery, and they don't have the rigorous criteria that a board certified plastic surgeon has.
How would someone determine what size is right for them?
Number one, just starting with the examination, I take a lot of measurements and different techniques during the examination to help figure out what is going to be right for you as far as silicone versus saline versus how big. There's also even different shapes of implants, so which shape is right for your breast and what's going to make it look like it is part of your breast. When we talk about cup size though, bra manufacturers haven't really figured out what a cup size is, and so therefore even from one store to the next or within a store, cup sizes vary quite a bit, and so it's hard to talk about cup sizes. But we do have patients go through a sizing process where you place silicone implants and sizers inside a bra and you look at yourself in the mirror. You get to test drive the implants a little bit, and that way you get a chance to figure out, is this what I'm really comfortable with, or is it something that I want to be a little bit bigger or a little bit smaller with? We try and make it just as friendly and easy as possible, and hopefully patients have a little bit of fun in the process.
Are there any concerns that people should have with the silicone implants?
The older implants used to be more of a honey type consistency, and the shells were relatively thin, and in those particular situations they would break easily and cause issues. With all that said, the newer implants, the ones that have been studied since 1992 and the ones that were released back on the market into 2006, are a silicone gel implant. They're affectionately referred to as a gummy bear implant because when you look at the inside of that gel, it really is like a warm gummy bear. I can cut an implant in half and I can squeeze on that and you'll see it bow out. But as soon as I let go, it goes right back in. So it's not like the silicone goes anywhere.
And if there are any leakage issues, are there any warranties for the client?
There are two major manufacturers of implants, Mentor and Allergan. And with either company, you have a lifetime warranty on the implants, such that if you get a leak in an implant, they'll not only replace that implant, but they'll replace the other one as well at the same time. With that, there's also costs that come associated with surgery. So if you have a leak, say within the first 10 years, silicone implants have an amount of money that the company will contribute to sort of defray the cost of that surgery. Saline implants tend to have a little bit less, but nonetheless have a certain amount of money that they will contribute. The nice thing about breast augmentation is that the downtime is really limited to about 3 days to a week. Now, that obviously depends upon a number of different things, such as is the patient having an associated lift with it, and how large of an implant are they going with? Those are things that can affect how long the downtime is after surgery. But we really like for patients to get back to a more normal routine and back to normal activities very quickly.
And any restrictions then during that time?
For a period of somewhere between 4 and 6 weeks, there are some restrictions as far as lifting and pushing and pulling. We want to make sure that that implant heals in the right location and stays right where we want it.
Okay, well great, all good information, and we thank you, Dr. Mills. And for more information, you can go to their website.
Thanks for joining us on this episode of StreetScape. I'm April Trupiano, your host, and you can find me at apriltrupiano.com. StreetScape is a part of the Two Guys Talking podcast network and brought to you by StreetScape Magazine.